Welcome everybody, this is Dr. Hani Nadeem. This lecture is about the anatomy of the perineum. First, what is the perineum? The two parts of the word, peri means around and neum means outlets, so it is the place that surrounds the outlets of the body at the bottom of the trunk. Where it is located at the bottom of the trunk between the two thighs. It extends from the skin below till the pelvic floor above. Its shape is diamond. What are the boundaries of this diamond? Anteriorly, we have the symphysis pubis. Posteriorly, we have the tip of coccyx. On each side, we have the ischial tuberosity. We have four borders of the perineum. The two anterolateral borders are the pubic arches. The two posterolateral borders are the sacrotuberous ligaments. An imaginary line between the two ischial tuberosities divides the perineum into two triangles. Posteriorly, the anal triangle, and anteriorly, the urogenital triangle. The bases of the two triangles meet together at the line joining the two ischial tuberosities. And as the ischial tuberosity is at a lower level than the symphysis pubis and the tip of coccyx, therefore these two triangles are oblique. They don't lie in the same plane. The anal triangle contains the anal canal in the middle, connected to two fibrous masses. Posteriorly, this is the anococcygeal body or the anococcygeal raphe, and anteriorly, this is called the perineal body. On each side, there is the ischiorectal fossa. Anteriorly, the urogenital triangle is divided by a membrane called the perineal membrane into a superficial perineal pouch, more superficial to the membrane, and a deep perineal pouch under the membrane, or actually above the membrane, because we are looking from the bottom of the body. In the first part of the lecture, we will cover the ischiorectal fossa and Pudendal Canal inside it. And in the second part of the lecture, we will cover the urogenital triangle with its two perineal pouches. The ischiorectal fossa, you have to know its boundaries and contents. And regarding the Pudendal Canal, you have to know its site and its contents, which are the Pudendal Nerve and the internal pudendal. Let's start with the ischiorectal fossa, where it is located. It is located on the sides of the anal canal, on both sides. So this is one ischiorectal fossa, and this is the other. Here at the bottom view, this is one ischiorectal fossa, and this is the second. Its size is 1 times 2. 1 inch broad, 2 inches in height, and also 2 inches antero-posteriorly. Its boundaries are: the floor is made by the skin, the roof is made by the levator ani muscle, the meeting of the roof with the lateral boundary is the apex of the ischiorectal fossa. Laterally, it is bounded by the obturator internus and its fascia. This fascia splits to make the Pudendal Canal. Medially, there is the external anal sphincter surrounding the anal canal, in addition to the two bodies that we mentioned, the perineal body and the anococcygeal body. Anteriorly, it is bounded by the posterior border of urogenital triangle, or superficial and deep perineal pouch. So it is bounded by the posterior border of perineal membrane with muscle superficial and muscle deep to it. They are the superficial and deep transversus perineal muscles of both sides. Posteriorly, it is bound by the sacrotuberous ligament overlapped by the gluteus maximus. Anteriorly, just above the superficial and deep perineal pouches, the ischiorectal fossa has what we call the anterior recess. This anterior recess extends above the deep perineal pouch between it and the pelvic floor. Infection in the ischiorectal fossa may spread to the anterior recess just above the deep perineal pouch. And you have to remember that when I say above, this means below what you see, because we are looking at the bottom of the body. The contents of the ischiorectal fossa are ischiorectal pad of fat, which is subdivided by septa into lobules. This fat is semi-liquid, so it allows distension of the anal canal. It contains blood vessels and nerves running in the Pudendal Canal. We have the Pudendal Nerve and internal Pudendal Artery. And running across the fossa, branches of these nerves and artery. These are the inferior rectal nerve and artery going to the anal canal. Although it is going to the anal canal, it is called inferior rectal. We have also the scrotal or labial vessels and nerves going to the scrotum or labium majus. And we have other nerves and vessels, the perineal branch of fourth sacral nerve, and the perforating cutaneous branches of S2 and 3. They enter this ischiorectal fossa through its posterolateral boundary. Sometimes infection from a perianal abscess may spread, leading to abscess in the ischiorectal fossa. By the way, it is better called ischioanal fossa because it is between the ischium and anal canal, not the rectum. So the newer name for it is ischioanal fossa. Ischioanal abscess has to be incised through the skin, and the locules separated by septa makes its drainage a bit difficult. However, if repeated infections occur in the inner region, an infected tract with an opening on the skin and an opening on the anal canal on the other side is fistula. It's anal fistula. Now let's talk about the Pudendal Canal. At first, where it is located on the lateral wall of the ischioanal fossa in the fascia of obturator internus, which splits to make this canal. It begins at the lesser sciatic foramen and ends anteriorly at the posterior border of the perineal membrane, leading to the deep perineal pouch above the perineal membrane. This is the perineal membrane. Above it is the deep perineal pouch, and below it is the superficial perineal pouch containing the roots of the genital organs, the root of the penis, And here we have this is the sacrotuberous ligament. This is the sacrospinous ligament. They convert the greater sciatic notch and lesser sciatic notch into greater sciatic foramen and lesser sciatic foramen. This is the levator ani muscle. Above it is the pelvis, below it is the perineum. So any structures going through the greater sciatic foramen leave the pelvis and enter the gluteal region. Any structure going through the lesser sciatic foramen comes from the gluteal region to enter into the perineum. So these structures enter the pudendal canal. These structures include the pudendal nerve laterally and the internal pudendal artery on its medial aspect. Now let's study those structures. At first, the internal pudendal artery. Here again, this is the sacrospinous ligament. This is the sacrotuberous ligament. This is the piriformis muscle, subdividing the greater sciatic foramen into a part above it and part below it. This is the lesser sciatic foramen. This is the here we have the perineal membrane. So between the levator ani and perineal membrane, we have here the deep perineal pouch. Below the perineal membrane into the fascia and skin, we have the superficial perineal pouch containing the roots of the penis in case of the male. Okay, now we have here the common iliac artery dividing into external iliac and internal iliac. The internal divides into posterior division and anterior division, and the termination of anterior division are two branches, the inferior gluteal and the pudendal. So the pudendal artery is a branch of the anterior division of internal iliac artery, one of the two terminal branches. It leaves the pelvis through the greater sciatic foramen below the piriformis, crossing the tip of the ischial spine, enters the perineum through the lesser sciatic foramen, runs forwards from the lesser sciatic foramen till the posterior border of perineal membrane through the pudendal canal on the medial side of the pudendal nerve. At the anterior end of the pudendal canal, it enters the deep perineal pouch, and then it pierces the perineal membrane anteriorly to reach the superficial perineal pouch, where it ends by dividing into two terminal branches, the dorsal and deep artery of the penis. The dorsal artery of the penis runs on the dorsal aspect of the three structures, the three erectile structures that make the penis. These are one corpus spongiosum in the bottom here that starts from the bulb of the penis, and two corpora cavernosa above it, one to the right and one to the left, that start from crura of the penis. So the dorsal artery of the penis runs above the corpus cavernosum, while the deep artery of the penis pierces the corpus cavernosum and runs within it. The branches of the internal pudendal artery are in this order. Remember, we have the anal canal, we have the scrotum, we have the bulb of the penis, and we have the body of the penis. So we have here 5 main branches. one to the anal canal. It's the inferior rectal artery. Should have been called inferior anal artery. It supplies the anal canal below the pectinate line, the lower part of the anal canal. The second branches is the perineal artery, which gives two scrotal arteries and branches to the perineal muscles. And then here we have what we call the artery of the bulb and the urethral artery. These pierce the perineal membrane to reach the deep perineal pouch, and they pierce the bulb and run through the corpus spongiosum on the sides of the penile urethra. The two terminal branches are the dorsal artery of the penis in case of the male, or dorsal artery of clitoris in the female, runs on the dorsum of the penis till the glans. And we have here the deep artery of the penis, or the deep artery of clitoris in the case of female, running within the corpus cavernosum. Now we will describe the anatomy of the pudendal nerve. Here again, we have the anal canal, the scrotum, the roots of the penis, and we have here the perineal membrane, and this is the fascia of the roof of the deep perineal pouch. Okay, remember we had a sacral plexus in front of the piriformis. From this sacral plexus, we have two terminal branches. One very large, which is the sciatic nerve, and one small, which is the pudendal nerve. Both leave the pelvis through the greater sciatic foramen below the piriformis. So it comes from the sacral plexus. Its root value is S234. It passes out through the greater sciatic foramen below the piriformis. It crosses the sacrospinous ligament, the back of the sacrospinous ligament. It enters through the lesser sciatic foramen, passing from the gluteal region to the perineum. It runs inside the pudendal canal, okay, on the side of the ischiorectal fossa. It is closer to the bone than the internal pudendal artery. That is to say, the artery is medial, the nerve is lateral. And the anterior end of the pudendal canal, it leaves the canal and enters into and divides into two terminal branches. Here it gives one nerve, which is the dorsal nerve of the penis, and a perineal branch, perineal nerve. So this is different from the artery. The artery continued into the deep pouch, pierced the perineal membrane to reach the superficial pouch. No, the nerve ends at the anterior end of the pudendal canal, gives the dorsal nerve of penis and perineal nerves. Its branches are three only. The dorsal nerve of the penis, the perineal nerve, and the inferior rectal nerve. We will talk a little bit about the details of each nerve. The dorsal nerve of the penis runs in the deep perineal pouch, pierces the perineal membrane to reach the superficial perineal pouch, then runs forwards along the dorsum of the penis or clitoris in the case of female till the glans. The perineal nerve gives muscular branches to the muscles of the perineum, and scrotal or labial branches to the scrotum or labia majora. The inferior rectal nerve carries two types of fibers to the lower part of the anal canal. Sensory fibers from the lower part of anal canal below the pectinate line. That's why this part of the anal canal is sensitive to pain. And motor branches to the external anal sphincter and to the levator ani muscle. Now we will revise the supply of the penis. But before that, we will have to revise what the penis is made of. First, there is a covering of skin and superficial fascia. And instead of the deep fascia, we have the penile fascia here, or the fascia penis. Inside, the penis is made of three erectile long structures. Two corpora cavernosa, which are fused together in the middle, or having a septum between them, and one corpus spongiosum below. These form the apparent part of the penis here, the part that appears outside of the body. These are the two corpora cavernosa united together, and this is the corpus spongiosum, and it ends in the glans of the penis. The root of the penis is the part hidden here in the superficial perineal pouch. The corpus spongiosum begins from what we call the bulb of the penis. It's also a erectile structure. These are actually continuous together. The different names are just given to the part outside the body and the part inside the body. The inside part is the bulb, the outside part is the corpus spongiosum. Same goes for the two corpora cavernosa. They separate here inside. Each one is attached to the pubic arch, and they are called crura. Each one is called crus. Okay, so the two crura unite to form the corpora cavernosa. The bulb extends to form the corpus spongiosum and the glans. Okay, now for the supply of the penis, we have three pairs of arteries, two veins, and one pair of nerves. Okay, the arteries, we talked about them already, right? All are branches from the internal pudendal artery. We have the dorsal artery, which runs above the corpus cavernosum here. And we have the deep artery of the penis, the second terminal branch of internal pudendal. It runs inside the corpus cavernosum. And we have the artery of the bulb and urethral artery, which run on the sides of the penile urethra within the corpus spongiosum. So these are the three pairs of artery. One in corpus spongiosum, one in the corpus cavernosum, and one outside the corpora. Regarding the two veins, we have one which is called superficial vein, superficial dorsal vein of the penis, and deep dorsal vein of the penis. They drain these corpora. When these veins constrict, the corpora become filled with blood. The arteries remain patent, pouring blood into the corpora and making them filled with blood, so the penis becomes erected. Where do these veins drain to? The superficial vein of the penis divides into right and left branches, which pass to the thigh to end in the great saphenous vein. The deep artery of the penis passes under the the symphysis pubis to enter into the prostatic plexus of veins. I'll tell you just a clinical hint about this deep artery of the penis after we finish the nerve. The single nerve on each side is the pudendal nerve, is the dorsal nerve of the penis, which is the continuation of the pudendal nerve running on top of the corpus cavernosum. So you can say that we, on each side here, we have a vein, right? On top of the corpus cavernosum. The vein, the artery, the nerve, from medial to lateral. When the deep artery of the penis does not drain, blood becomes stagnant in it. Like, for example, when we have prostatic cancer or we have cancer in the pelvis, this will lead to occlusion of the prostatic plexus. This vein does not drain, and the penis remains in a state of erection, which is very painful, called priapism. Now we came to the second part of this lecture, which deals with the two perineal pouches. We have to know the boundaries and the contents of each pouch, the deep and superficial perineal pouches. And we will cover the anatomy of the external genitalia. We have already covered the anatomy of the penis. So now we will cover the anatomy of the vulva. The urogenital triangle is subdivided into two perineal pouches by three septa. The deep perineal pouch, and the superficial perineal pouch. The three septa are the superior layer of urogenital diaphragm. Here it is. It makes the roof of the deep perineal pouch. And the perineal membrane, which is the inferior layer of urogenital diaphragm, separates the deep perineal pouch from the superficial perineal pouch. And the third is the superficial fascia, which extends into the scrotum and the penis and is called collis fascia. The boundaries of the superficial, the deep perineal pouch are superiorly, we have the superior fascia of urogenital diaphragm. Inferiorly, we have the perineal membrane, or the inferior fascia of urogenital diaphragm. On each side, we have a pubic arch. Anteriorly and posteriorly, this is closed by fusion between the perineal membrane and the superior fascia of the urogenital diaphragm. They are fused anteriorly and fused posteriorly. So this space is completely closed. Its contents in the male are 2 times 3. We'll see how. 2 organs, 2 muscles, and 2 neurovascular structures. Okay, let's see at first the 2 organs. The 2 organs are the membranous urethra, that is the continuation of the penile urethra. It is the connection between the prostatic urethra and the penile urethra. As it lies between 2 membranes, it's called membranous urethra. And on each side of the membranous urethra, we have a Cowper's gland that is called the bulbourethral gland. We have 2 muscles in the deep perineal pouch. We have filling the whole triangle, the sphincter urethrae here, which is the internal urethral sphincter. The external urethral sphincter, which is voluntary, made of striated muscles, and a muscle behind here called the deep transversus perineal. The 2 neurovascular structures are the dorsal nerve of the penis and the continuation of the internal pudendal artery. Okay, now let's see the contents of the female. They are also 2 times 3, 2 organs, 2 muscles, 2 neurovascular structures. The 2 organs that we have here are the urethra. Remember that the urethra in the female is one structure not divided into parts, because it's only 4 centimeters in length. And we have the vagina behind it. Okay, we don't have here a gland. The 2 muscles are the same. The sphincter urethrae filling the deep perineal pouch, and the deep transversus perineae on the posterior border. As the sphincter urethra is filling the whole triangle, the fascia above it and the fascia below it, together with the muscle, are called the urogenital diaphragm. Okay, that's why we call the upper fascia of the urogenital diaphragm, and the lower fascia of the urogenital diaphragm, which is actually the perineal membrane. Okay, and the 2 neurovascular structures are the internal pudendal vessel and the dorsal nerve of the clitoris. Now we'll talk about the superficial perineal pouch. Here it is. Its boundaries are: its roof is made by the perineal membrane. Its floor is made by superficial fascia called collis fascia. On the side there is the pubic arch. Posteriorly, the fascia of the roof, the perineal membrane, and the fascia of the floor, the collis fascia, are fused together. So posteriorly, this space is closed. Okay, the roof and floor are united here. However, anteriorly, it communicates with the scrotum, the penis, and the anterior abdominal wall. The contents in the male are 3 times 3. We have 3 erectile roots of the penis, the bulb in the middle, and the 2 crura. Here we are. The bulb is continuous with the corpus spongiosum and the glans. It is attached to the perineal membrane and is pierced and traversed by the penile urethra. The crura are right and left. They extend as the corpora cavernosa. They don't get into the glands. They are attached to the pubic arches. There are 3 covering muscles that cover these erectile structures. Those on the sides are called ischiocavernosus. It covers the crus of the penis, and when it contracts, it has the crus and the corpus cavernosum engorged with blood, preventing return of blood from them. So it maintains erection. The second one covers the bulb here. It's called bulbus spongiosus, and as you can see, it's bipinnate here. It winds around the penis and fibers on one side and fibers from the other side, and then reunite on its dorsum. So when it contracts, it squeezes the corpus spongiosum and squeezes the urethra to expel the last drop of urine or the last drop of semen during ejaculation. And we have these transverse muscles, which are called superficial transversus perineal. They give support to the perineum and the erectile tissues. The three neurovascular structures are the dorsal nerve of the penis, which pierces the perineal membrane and continues above the corpus spongiosum, and the two terminal branches of the internal pudendal artery. That is to say, the deep and dorsal arteries of the penis. In addition to the artery of the bulb that pierces the perineal membrane to enter the bulb of the penis. Together with scrotal vessels coming from the perineal branch of internal pudendal artery. The contents in the female are also 3 times 3. We have 3 pairs of structures. The 2 bulbs of the clitoris, or bulbs of the vestibule, I'm sorry, they lie on the sides of the vagina and urethra. They are attached to the perineal membrane and they fuse together anteriorly. They are made of erectile tissue. And we have the 2 crura, right and left. Each is attached to the pubic arch. Both unite anteriorly to form the clitoris. So the clitoris is erectile tissue, and it's made by the 2 crura, and the bulb does not share in its formation. And we have 2 glands here at the posterior end of the bulb of vestibule. These are the Bartholin glands, or the great vestibular gland. They secrete mucus around the vagina to lubricate sexual intercourse. They open on the sides of the vagina. Now we have 3 pairs of muscles, same as in the case of the male. We have ischiocavernosus on the crus, and we have 2 bulbospongiosus. They are not fused because we have here the vestibule of the vulva. They are 2 muscles, bulbospongiosus, and we have the superficial transversus perineal. The 3 neurovascular structures are the same as in the case of the male, but we change the name of the penis to the name of the clitoris. So we have the dorsal nerve of clitoris, the deep and dorsal arteries of the clitoris, which are the terminations of the pudendal nerve and internal pudendal artery. We have the artery of the bulb, and we have, instead of scrotal branches, we have labial branches, labial arteries and labial nerves. Now we will give a summary about the female external genital organ, or the vulva. It's made of 2 labia majora, which are made by fat covered by hairy skin, and they unite anteriorly together to form the mons pubis, which has pubic hair. And by the way, pubic hair in the male have the pubic hair in the female have an upper horizontal boundary. In the case of the male, it is triangle. Its apex reaches probably till the umbilicus. They unite together posteriorly, the 2 labia majora, to form the posterior commissure here. Inside the labia majora, we have the labia minora, which are erectile in nature, and they are not covered by hair. They unite anteriorly above the clitoris and below the clitoris. Above the clitoris, they form the prepuce. Below the clitoris, they form the frenulum. And they unite posteriorly to form the fourchette, which becomes divided when we do episiotomy. And after after the lady gives birth to her first child, the fourchette is usually cut. The third structure is the clitoris, and you remember it's erectile. It's made by union of the two crura, and it's highly sensitive because it has rich nerve supply. Now, between the two labia minora, this fusiform space is called the vestibule. It receives the following openings: the external urethral meatus, the vaginal orifice guarded by the hymen in virgins. On the sides of the vagina, we have the Bartholin glands opening, one on the right and one on the left. And on the sides of the urethra, we have the urethral glands opening. They are called Skene's glands. Now, I will ask you two questions. Which part of the perineum is dissected in an operation of piles, Bartholin cyst, episiotomy? Please pause the video, answer the questions by yourself, then come back to hear the answers. Okay, welcome back. In the operation of piles, of course, we work posterior to the imaginary line between the two ischial tuberoses. So we are working in the ischioanal fossa or the anal triangle. Bartholin cyst, the Bartholin gland is in the superficial perineal pouch. So we are working in the superficial perineal pouch of the urogenital triangle. In the case of episiotomy, we cut through the vaginal orifice posterolaterally. Here we cut both superficial and deep transversus perinei. We probably reach till the ischiorectal fossa. So we cut through the two perineal pouches and the ischiorectal fossa. Well, another question is, how would urine spread in the case of rupture of the membranous urethra and in the case of rupture of the penile urethra? Again, pause, think of the answer, and come back for hearing the answer. Okay, now remember that we have the membranous urethra in the deep perineal pouch, and then as it leaves by piercing the perineal membrane, it enters the superficial pouch and pierces the bulb of the penis, making the penile urethra. So when it is in the deep perineal pouch, if it is injured, and usually its injury is due to faulty catheterization, false path of the catheter piercing the urethra, in such case, because it's the narrowest part of the urethra, in such case, urine will be extravasated into the deep perineal pouch. And as we said, the deep perineal pouch is a totally closed space. So the urine is limited to the deep pouch and does not spread anywhere. But if this membranous urethra, as it enters into the bulb of the penis and becomes the penile urethra, if this part is ruptured, and usually this occurs when somebody is falling on the perineum, on a sharp object on the perineum, like an edge of a cover of sewage, which is opened, and somebody is falling on it, hitting the perineum hardly, and in such case, rupture occurs here, and urine will extravasate in the superficial pouch. We said that the superficial pouch is closed posteriorly, but however, anteriorly, it is continuous with the scrotum, the penis, and the anterior abdominal wall. So extravasated urine will collect into the scrotum, the penis, the anterior abdominal wall, and then it tries to go down to the thigh, but attachment of the membranous layer of superficial fascia of the abdomen with the deep fascia of the thigh below the inguinal ligament in a horizontal manner will prevent its descent into the rest of the thigh. So it will be trapped above this horizontal line of attachment of fascia. Now we reach the end of this lecture. Thank you for listening. If you like these lectures, please subscribe to my YouTube channel and hit like. Thanks again.